Hello, my name is Dominic Josetis, and I want to welcome you to the FloridaHealthFinder.com. Florida Health Finder is operated by the Florida Agency for Healthcare Administration. This is an official state government website that provides the public with easy-to-access healthcare information. This means it should be both accurate and high quality. In this video, I'm going to be addressing middle-aged adults between 45 and 65 who have been diagnosed with type 2 diabetes and need information to help manage their care. Up in the right-hand corner here, there's going to be 4 red boxes. The first is Health Finder, the second is Price Finder, the third is My Florida RX, which means medication, and the fourth is Cancer Finder. We're going to select the first one here. There should be 4 tabs that come up here. The first tab is Agency Information, the second is Healthcare Information. We're going to click on the Healthcare Education. Then we're going to go to the first bullet point here, Health Illustrated Encyclopedia. And there's going to be a list of topics. However, the easiest way to do this is by just typing in diabetes here. I'm going to go down to the third bullet right here, diabetes. And this is going to give us information on both types of diabetes. It's going to start off by a definition here, stating that diabetes is a long-term or chronic disease in the body where it cannot make or cannot regulate blood sugar. I'm going to scroll down here. It's going to talk about the alternative names, type 1 and type 2. And then the causes, which is where the insulin, which is a hormone produced in the body, cannot control the blood sugar. So I'm going to scroll down here, and it's going to talk about the 2 types of diabetes, type 1 and type 2. Type 1 is less common. People are typically born with it. It's your body doesn't make enough insulin, whereas type 2 is more common. Typically you get it in middle-aged, and that is your body is resistant to the type of insulin being made. We're going to scroll down here and we're going to talk about our symptoms. There are a few symptoms, but the big 3 are blurry vision, excess thirst, and fatigue. So if you're always feeling tired and you're eating more and you're still not feeling rejuvenated, those are the symptoms for diabetes here. And if you come down here, it's going to talk about the tests. The big 2 are fasting blood glucose level and A1C. Fasting blood glucose, that checks how much blood sugar you have in one day. However, if you want an average of what you've done that week or that month, it's the A1C. So the blood test, that's when you prick your fingers after you've eaten to see how much your blood sugar has gone up. If you scroll down a little bit farther here, and then it talks about the treatment here. Unfortunately, type 2 diabetes is generally, it can be managed, but it can't be treated. So the best things to do are to exercise and maintain a healthy weight, because gaining weight means there are more fat cells, which makes the insulin resistant, and it makes it harder for your blood pressure or your blood sugar to improve. I'm going to go back up to the top here, and on this Read More chapter, I'm going to hit type 2 diabetes. I'm going to go down here, and it gives a little bit more information. It goes into more detail about what is type 2 diabetes, more detailed about the cause here, and more detailed symptoms. However, I want to go over to manage your blood sugar, and this is the important thing to make your blood sugar stay within a healthy range. We're going to go down here, and it gives what we should do to have a healthy lifestyle here. Ideally, exercise for 30 minutes a day and avoid sitting for long periods of time, more than 30 minutes. And so maintain an active lifestyle. It doesn't need to be exercise, but it does need to be an activity that you enjoy to keep it consistent, to keep the weight down. I'm going to go down a little bit further here. And then, of course, the ways to check your blood sugar. This is most important before and after meals, and also when you go to bed, because you don't want to stop eating and then your blood sugar goes down as you're sleeping, and if it goes down too low, you could have issues waking up. So that's a very important thing right here. And then if you want to go back up to the top, you can always type in more information here if you want to see specific things about blood sugar or types of insulin or types of medication. However, I just want to reiterate for our video overview that our learning objectives were to identify type 1 and type 2 diabetes, but also how to read blood sugar. And this was designed for middle-aged adults between 45 and 65. Thank you for your time. I hope you have a good evening.